Hi, everyone. Welcome to Springer Nature's fourth quarter key clinical medical books presentation. I'm Jenny Liu, Trade Sales Manager for Springer Nature, and we have here with us today Marit Vagstad, our Director of Sales for Trade Sales in the Americas. So we'd like to kick off our new medical titles presentation. These are curated by our editorial team and sales team and should be our books with the highest sales potential. Kicking it off is our titles in orthopedics. I wanted to go into our orthopedic books a little bit just to talk about our program and what we're doing and why we have the best collection of medical books out of all of our competition. So Springer boasts a dynamic library of titles in orthopedics covering every joint disorder or surgical procedure. And over the last 3 years, especially, Springer has owned a clear majority of the market in terms of newly published titles with close to 50% of the share every year. Orthopedics is a robust field for new books, and one reason for that is the technological advances that occur every year, significantly shaping the field, such as new and better implant devices, many using sensor-enabled features, pretty cool, and a wide range of robotic surgery procedures that allow fewer and smaller incisions, which is always good. You don't want anything too invasive, reducing complications and postoperative care, and just overall improving patient outcomes. So a key way that Springer has been able to dominate the field is because we have a long-standing and successful co-publishing arrangement with many prominent orthopedic societies, such as European Society of Sports Traumatology, Knee Surgery and Arthroscopy, as well as the International Society for Arthroscopy, Knee Surgery, and Orthopedic Sports Medicine. The collaboration with Springer has brought so far 27 publication books with 15 forthcoming titles that really benefit the partnership for both stakeholders in this field. So to go over our books, we have 3 that are key highlights here in the category out of the 15. The first is Cartilage Injury of the Knee, State-of-the-Art Treatment and Controversies. Cartilage injuries Sorry about that. Cartilage injuries of the knee are common, and diagnosis and treatment options have continued to evolve. Cartilage injury of the knee focuses on current non-operative and surgical treatment strategies, highlighting different approaches from an international perspective. Discussed in the books are basic science of cartilage structure and function, expert perspectives on imaging and diagnosing, as well as workup of athletes and patients presenting with acute or chronic cartilage injury. The book also provides an evidence-based approach for cutting-edge cartilage repair and restoration, and it is certainly vital reading for orthopedic and sports medicine surgeons, fellows, and residents, and should be of interest too for sports trainers, physiotherapists, medical students, postgrad, and physical medicine and rehab specialists. The next title we have is Wrist and Elbow Arthroscopy with Selected Open Procedures. This book is revised and significantly expanded in its 3rd edition. It's nearly triple in size from the previous edition, which was in a 2-volume set. William Gessler is the editor of the book, Dr. Gessler, and he for this book is the gold standard in arthroscopic techniques for wrist and elbow. He is incredibly influential, and now he has a book that discusses why he thinks the open technique compared to arthroscopic surgery is best. Selected chapters include video supplements for additional real-world demonstrations of techniques, generously illustrated with intraoperative photographs and full-color figures. Chapters cover arthroscopic techniques are full length and in detail, but open techniques are also discussed as well. This brings together a truly international cross-section of experts and thought leaders in orthopedics and hand surgery. And so with wrist and elbow arthroscopy with selected open procedures, it will remain a premier resource and the gold standard for clinicians working in this field. The next title we have is Knee Arthroscopy, How to Succeed. So very important for anyone who wants practical guidance. And so we're thinking of orthopedic surgeons and residents who want to master knee arthroscopy techniques in their daily practice. The book is based on scientific evidence, but also mirrors expert know-how and best practices and equips readers with essential information, tips and tricks to avoid and prevent intraoperative minor and major complications. It is really well written, and the voice is clear and uniform, and it features a wealth of pictures. The book guides the reader step by step through each of the presented arthroscopic procedures, from patient positioning through meniscal suture approaches and hamstring grafting to ACL, PCL, and MPFL reconstructions. So this book covers all of the basic and practical aspects of the procedure and is a must read for any resident or young orthopedic surgeon that wants to gain insight into the surgical techniques and surgical techniques that they want to combine in their day-to-day practice, and should be a valuable tool for practicing orthopedists, sports physicians, and physiotherapists who have an interest in knee arthroscopy. And that is a highlight of our orthopedics list. And we are moving forward into more of our Springer Nature Clinical Medicine highlights for Q4, kicking it off with Marit.
Thanks, Jenny. Teaching Pearls in non-invasive mechanical ventilation uses real-world clinical cases to provide insights into non-invasive mechanical ventilation, otherwise known as NIV. This collection is written by leading international teachers and experts, and the book is edited by Dr. Antonio Esquinas, who is an intensive care physician in Spain, an active member and international fellow of the American Association for Respiratory Care, a fellow of the American College of Chest Physicians, and the president of the International Association of Non-Invasive Mechanical Ventilation. This content is well suited for pneumologists, intensivists, and anesthesiologists, and describes how to evaluate parameter settings, ventilatory modes, and interfaces. Next, please. Global cardiac surgery capacity development in low and middle income countries provides a focused resource on how cardiac surgery capacity can be developed and how it assists in the sustainable development and strengthening of associated health systems. This is a valuable resource for physicians practicing medicine in African countries and other parts of the developing world. The book provides a model for improving cardiac healthcare where resources are limited. Relevant aspects of governance, financial modeling, and disease surveillance are all covered, as well as medical curriculum and practical advice for overcoming key challenges. The book's editor is a cardiovascular surgeon specializing in global health system innovation with an emphasis on addressing rheumatic heart disease. He is currently a faculty member at Harvard Medical School and an adjunct professor of surgery at the University of Ghana. Next, please. Palliative care in cardiac intensive care units is a comprehensive overview of what will improve the training is a comprehensive overview that will improve the training of cardiologists, anesthesiologists, palliative care doctors, and ICU nursing staff. This book analyzes the main topics of palliative care in cardiac intensive care units, from the changing epidemiology of patients admitted to the ICU to the main clinical and ethical issues. In these units, care has shifted from acute coronary syndrome patients towards elderly patients with a high prevalence of non-ischemic cardiovascular diseases and a high burden of non-cardiovascular comorbidities. This collection is written by opinion leaders in their respective fields who share their vast experience improving the culture and clinical competence of the cardiac ICUs. Next, please. Mechanical Ventilation in Neonates and Children is a new textbook that comprehensively covers mechanical ventilation for young patients, integrating the latest knowledge and understanding of developmental biology and disease-specific physiologic differences. It describes age growth-related variations in pulmonary physiology and reinforces the importance of therapy, monitoring response, and ventilatory setting adjustments. The book is authored by a highly revered US-based author team with affiliations at the Children's Hospital of Michigan, Wayne State School of Medicine, the Children's Hospital of Pittsburgh, and the Pittsburgh School of Medicine. Next, please. Guided implant surgery is a modern method of installing dental implants in patients missing or replacing teeth that uses computers to scan the patient's mouth and create a 3D model, which allows the dentist to plan the procedures before carrying it out. Guided surgery and implantology is written by experienced experts in oral implantation surgeries and supports practitioners as a learning tool in guided implantology using case studies that illustrate different templates for full guided surgery. Filled with illustrative cases, this book will be useful to oral surgeons starting out, as well as those with more experience. Over to Jenny. Jenny, you're on mute.
Hi, everyone. Our next title here is Drug Delivery in Dermatology, Fundamental and Practical Applications. So for the field of dermatology, drug delivery is a hot topic with a PubMed search generating 203,000 articles. Our skin accounts for approximately 15% of our body. It provides an entry and exit barrier to various substances, offers effective protection against harmful substances such as microorganisms, ultraviolet radiation, and is also paramount in immunology and body homeostasis, preventing dehydration and loss of essential minerals. In the treatment of patients, the topical route has a number of advantages over parenteral routes. However, the outer skin only allows penetration of 1 to 5% of substances applied topically, making this application much less efficient. So to address this, techniques have been developed that have been aimed at optimizing drug skin penetration by means of chemical, mechanical, and physical methods, such as adding permeating active agents and using occlusion, microneedling, lasers, and intense pulse light. So it is now possible to deliver medication to different skin layers or transdermally to the systemic circulation. This book offers a very detailed review of this emerging therapeutic option, including the various methods available. And this unique book guides physicians and doctors in selecting the correct technologies, techniques, and products for each patient for drug delivery through our skin. Our next title is Dermatology in a Rural Setting, Organizational, Clinical, and Socioeconomic Perspectives. So this book addresses the uneven distribution of healthcare between people in dense cities and more rural cities. The book will offer solutions that will motivate dermatologists to make a difference, including free rural clinics and incentives to attract dermatologists to underserved areas. The book is quite comprehensive, yet very concise, so a good read. The book encompasses not only the logistics of healthcare issues, including location, incentive, and a setup of facility, but it also includes insight into the effectiveness of teledermatology, which is a practice more commonly utilized due to the COVID-19 pandemic. So it's a very timely book and should be an invaluable resource for dermatologists, resident dermatologists, and academic physicians interested in rural and urban health. The next title we have is Medical Health Informatics. So this is a textbook that provides a detailed resource introducing the subdiscipline of mental health informatics. Mental health informatics is a branch of health or clinical informatics. It focused on the use of IT, information technology, and information to improve mental health. So data driving health. It systematically reviews the methods, paradigms, tools, and knowledge base in both clinical and bioinformatics and across the spectrum from research to clinical care. Key foundational technologies such as terminologies, ontologies, and data exchange standards are presented and given context within the complex landscape of mental health conditions, research, and care. So mental health informatics is a comprehensive introductory resource for students, educators, and researchers in mental health informatics and related behavioral sciences. It is a great resource for use in a survey course in both pre or postdoctoral training programs, as well as healthcare administrators, funding entities, vendors, and product developers working to make healthcare much more evidence-based. And the next title is Biology and Treatment of Leukemia and Bone Marrow Neoplasms. This book offers in-depth coverage of current diagnostic and risk stratification techniques for leukemia and bone marrow neoplasms. It discusses novel treatments and pathways that may serve as targets for leukemia therapy. There's particular focus on the molecular abnormalities that are drivers of leukemia and on their detection by modern molecular techniques. Detailed attention is devoted to targeted therapies, including novel drugs, and to potential targets for future drug development. So this book should be of special interest for hematologists, oncologists, and cancer researchers. It is also of value for hematology trainees and medical students. and textbook of liver transplantation. So liver transplantation requires a complex and varied multidisciplinary approach involving not only a hepatologist, but surgeons, pathologists, psychologists, professional educators, nurses, and in the case of young patients, pediatricians. So this textbook provides an overview of the management of problems involved in liver transplantation for acute and chronic liver disease, pediatric liver transplantation, and the psychosocial aspect of liver transplantation. With a very precise and didactic description of all phases of liver transplantation for chronic and acute diseases, from managing the waiting list to post-transplant complications, this is a great tool for fellows, trainees, and specialists in the field seeking an accurate framework for liver transplantation in its many phases. The volume editor is an eminent figure in the world of hepatology. Her name is Dr. Patricia Bura. She is currently the elected chair of public affairs committees at the European Gastroenterology. And in 2021, she obtained a fellow of the American Association for the Study of Liver Diseases. And over to Marit.
Thanks, Jenny. Neurology in Migrants and Refugees is the result of the reflections and work of the specialty group on neurology in migrants of the World Federation of Neurology. The volume provides a synthesis of migrants' health in relation to the Sustainable Development Goals and the 2030 Agenda, and an up-to-date overview of neurological diseases among migrants, refugees, and ethnic minorities. The book is composed of both general chapters dealing with the history of migration, the relationship between climate change and migration flows, the migration and neurosciences research, and the barriers to migrants' health. Other chapters deal with the particulars of the common neurological diseases, such as cerebrovascular diseases, epilepsy, dementia, movement disorders, multiple sclerosis, headache, functional and mental disorders. In addition, the neurological manifestation of COVID-19 and ethnic minorities is discussed. This book will be of value to neurological departments as a reference and can also be used as a basic textbook for teaching neurology along with issues of health inequality. Next, please. Guide to Complex Interventional Endoscopic Procedures walks readers through the setup, supplies, nursing considerations, troubleshooting, and steps to successfully assist during cutting-edge interventional gastroenterological procedures. This key resource is the first of its kind, written to help endoscopic surgical centers prepare and train staff in order to offer these new and on-the-rise procedures to their patients. This step-by-step guide includes a full range of highly advanced procedures that are on the forefront of medicine and will help nurses, technicians, and endoscopists carry out these procedures safely and effectively. The editors of this book include a senior endoscopy technician and 2 registered nurses, all with more than 15 years of hands-on experience in endoscopic procedures and instruction. Next, please. Despite the substantial adverse impact of malnutrition on patient and healthcare outcomes, the specialized management of this condition is often under-resourced, overlooked, and under-prioritized by both older adults and their treating teams. Interdisciplinary Nutritional Management and Care for Older Adults is a new open access title that supports nurses as leaders and champions of multimodal interdisciplinary nutrition care for older adults. The title focuses on practical guidance and advice, while a variety of team members may contribute to supportive nutritional care. The nursing profession provides a clear focal point because they are the backbone for interdisciplinary teamwork and addressing essential patient care needs. Next, please. Written by a multidisciplinary group of experts reflecting the evolution of the field, Fundamentals of Cancer Pain Management presents a timely update to the modalities currently available for the treatment of cancer pain in the form of a concise and organized recommendations for the practicing clinician. Treatment modalities include pharmacological approaches, interventional procedures, and palliative surgical options, all of which are discussed clearly and concisely. Further topics include new and emerging treatments for cancer pain, survivorship considerations, pain management in special populations, and the implementation of system-based pain programs. Oncologists, Palliative care physicians, allied health professionals, and other practitioners involved in caring for cancer patients will find this to be a rich source of evidence-based insights into effective pain management. Next, please. The field of regenerative medicine is focused on developing and applying new treatments to heal tissues and organs and restore function lost due to aging, disease, damage, or defects. This new title, Regenerative Medicine, focuses on musculoskeletal disorders, exploring the rapidly growing subspecialty of regenerative medicine and pain management. It provides concise guidelines and instructions for healthcare providers interested in implementing this novel therapy. This is the first comprehensive text on this subject and will inspire medical practitioners to integrate this subspecialty into pain management treatment. The book examines various therapies such as stem cell collection, allograft therapies, and bone marrow aspirations. It also offers help with medical diagnosis and procedural guidance for ultrasound imaging, discography, local anesthetics, and anticoagulation medication. Next, please. Cannabinoids and Pain provides a balanced view on cannabis and cannabinoids as a pain treatment, presenting the physiology of the endocannabinoid system and offering strategies on when to recommend medical cannabis and the pros and cons of cannabis as a substitute for opioids. The book includes an introduction to medical cannabis, including its history, regulations, and the general attitudes of pain physicians. The book then explores the biological effects of marijuana and its pharmacology. Challenges of this treatment method are also clearly addressed, including quality control, brain development risks, vaping hazards, and withdrawal. Lastly, the book provides a glimpse into the future of cannabis medical research. This book is intended for primary care physicians, pain and palliative care physicians, and oncologists seeking comprehensive coverage of this multifaceted topic. Next, please. Migraine, Emerging Innovations and Treatment Options addresses the complex nature of treating this common pain condition and underscores the intricacies of diagnosis and management. The book covers proper headache diagnostic tools and treatment options and consolidates emerging and current evidence and treatment information into a concise and useful guide featuring high-quality images, tables, as well as an educational video. Treatment options for chronic migraine disorders now include immune modulation, stem cell regenerative therapy, new therapeutics for use in pediatric migraine, prescription drugs, dietary modifications, and surgical treatments. This quick reference covers all established and emerging treatment options, filling a gap in the current literature. Over to Jenny.
Okay, and we have here Public Health Behind Bars. So this is a long overdue update of the first edition that first published in 2007. This timely interdisciplinary volume takes a comprehensive look at factors that impact correctional health care and the related implications for public health and public health policy. The authors identify the most compelling health problems behind bars, including communicable diseases, mental health, addiction, and suicide. It pinpoints systemic barriers to care and explains how correctional medicine can shift from emergency or crisis care to primary care and prevention. So new in the second edition are chapters on correctional nursing, transitions from prisons to communities, and the root cause analysis for quality improvements, as well as revisions and updates to more than half of the chapters that were in the first edition that published in 2007. Public Health Behind Bars should be of immediate interest to correctional health practitioners and correctional administrators. This text is also essential reading for civil rights attorneys, journalists, students of criminal justice, public health, community health, and much, much more. The next title is Treating Opioid Use Disorder in General Medical Settings. So opioid-related deaths in the United States are a significant public health crisis, and this book is an invaluable reference for medical practitioners seeking to integrate opioid use disorder treatment into their general medical settings, including primary care, the inpatient hospital, the emergency department, and fills the gap in drug use and addiction treatment knowledge for care providers. This is a timely and concise book. Opening chapters examine the history of opioid use disorder pharmacology and treatment, as well as the principles of care and treatment for those impacted patients. Chapters also analyze the shortcomings of current approaches to opioid addiction, including the high costs and low value of acute care delivered by minimally trained providers. It'll offer guidance for practical integration of effective opioid use disorder treatment into a larger range of healthcare settings. And this book is socially conscious and practical and will certainly serve as a crucial evidence-based resource for physicians, nurse practitioners, physician assistants, nurses, and other healthcare professionals. Modern breast cancer imaging. So the available information on breast cancer has evolved so rapidly that a textbook understanding is no longer sufficient to make sound therapeutic decisions. Furthermore, the latest findings and data are spread through so many various literatures and throughout the medical field that it makes it difficult for medical professionals to keep up to date on these advances and apply them to their day-to-day work. So this book provides updated information on breast cancer, such as the modern molecular classification and staging, and demonstrates how imaging with pathological correlation can be used in management decisions. In addition, it identifies the most suitable imaging modalities for screening, diagnosis, and monitoring for each clinical case. So given its scope, the book offers a valuable resource for all medical professionals practicing or still in training whose work involves breast cancer, including radiologists, breast surgeons, pathologists, radiotherapists, and nuclear medicine professionals. Okay, practical imaging informatics. Practical imaging informatics is a discipline which has evolved very rapidly in terms of diagnostic tools and devices. Radiology is a constantly evolving field. So this new edition is a comprehensive source of imaging informatic fundamentals and how those fundamentals are applied in everyday practice. So the role of an imaging informatics professional is critical in healthcare, and the scope of their profession has grown far beyond the boundaries of picture archiving and communication systems. A successful imaging informatics professional must understand all of the new software that is currently in the medical environment and all of the software systems that are networked together in that environment. So there are many layers that one must know in the workflow of all imaging team members, and they also need to have a base in several medical specialties and be fully capable in the realm of information technology. So this is a really great guidebook that has been organized to follow a logical progression from basic background information on the information technology out there, as well as combining clinical image management through daily operations and troubleshooting and long-term planning for anyone in the field of imaging informatics. This is written by a team of renowned international authors from the Society of Imaging Informatics in Medicine and should be an indispensable reference for the practicing imaging informatics professional. Medical imaging contrast agents. This volume of medical imaging contrast agents highlights and broadens our understanding of the correct use and the possible contraindications of contrast agents applied in radiology. It also includes essential data on the use of contrast agents, such as scanning protocols in the context of various clinical conditions, side effects, and ways to avoid nephrotoxicity risks related in iodinated contrast, and is a comprehensive manual that addresses all professionals involved in radiological imaging and should be an invaluable tool for radiologists and technologists, as well as for residents and clinicians. The volume editors, Professors Turk and Ross, have published several books with Springer Natures. They have a very good track record, and so this should be a very comprehensive book in the field of radiology. Okay, over to Marit.
Thanks, Jenny. Andrology is the medical specialty that deals with male health, particularly relating to problems of the male reproductive system and neurological problems. What may be less known is that many andrological diseases that occur in adulthood actually originate before the age of 18. Pediatric and adolescent andrology provides comprehensive coverage of the current guidelines, discoveries, and expert consensus on pediatric and adolescent andrology and offers a unique compendium for all andrologists, endocrinologists, pediatricians, and neurologists for treating and diagnosing younger patients. Written by respected experts in the field, this book constitutes an innovative resource combining updated, reliable, and comprehensive information with agile consultation in order to provide a streamlined approach to the care of children and adolescents with such disorders. Next, please. Penile implant surgery gathers the latest information and findings in the field of sexual medicine and offers valuable training and teaching material for those who plan to specialize in penile implant surgery. This audience includes residents and fully trained urologists, as well as fellows and practitioners in sexual medicine and reconstructive urology. Penile implants have been an effective treatment for erectile dysfunction for more than 40 years. However, there is a growing interest in this treatment option, and the number of procedures is expected to increase in the future. This comprehensive book discusses various aspects of penile implant surgery, ranging from indications to long-term complications. It addresses the most common and serious challenges regarding penile implants, which are rarely discussed in other literature on this subject. Next, please. Electroporation in veterinary oncology practice is the first edited collection on veterinary applications of electroporation. Electroporation offers a precision tool to target cancer cells without destroying surrounding tissue structures. This opening of tumor cell membranes facilitates local control of solid tumors, either through the delivery of chemotherapeutics or by direct ablation of tissue using electric fields. In addition, transfer of gene-based products into the cancer cells can be used for genetic vaccination to achieve systematic response and cancer control. Written by an internal team of experts, this book presents worldwide emerging therapy options for cancer treatment in veterinary oncology practice. It describes control of easily accessible lesions as well as deep-seated tumors and presents a practical approach for the treatment of both. Vets will learn the benefits of gene electrotransfer and will be taught the proper timing, usage, and combination of electrochemotherapy as a multimodality component of cancer treatment in animals. We continue to publish titles about the COVID-19 pandemic. The most important to highlight for Q4 include those seen here. The Science and Politics of COVID-19 is a fresh and readable account of the COVID-19 pandemic and how scientists and medical doctors are helping governments to manage this crisis. The book contains interviews and exchanges with dozens of scientists, doctors, experts, government representatives, and journalists who have been working on the front lines of the global pandemic and provides valuable lessons for the future management of public health disasters. This is priced and discounted for a trade audience seeking information about the pandemic and the future of health policy around the world. Written for physicians, engineers, and do-it-yourselfers interested in developing inexpensive transitory ventilator support devices, Mechanical Ventilation Amid the COVID-19 Pandemic provides a qualitative appraisal of numerous transitory ventilator devices developed during the COVID-19 pandemic and explores the mechanics, considerations, and concerns of emergency ventilator components, as well as a detailed framework for beginners and experts alike to develop their own emergency ventilation systems. This book is the first of its kind to discuss the respiratory pathophysiology underlying COVID-19 and serves as a historical record of the collaborative and innovative response to the ventilator shortage managed throughout the pandemic. Meeting practitioners where they are, Critical Care of COVID-19 in the Emergency Department is a first of its kind guide to best practices for those caring for critically ill COVID-19 patients. The title provides crucial information for the management of the emergency department and offers clinicians best practices in everything from personal protection to evaluation and diagnosis of the illness. It breaks down care of various comorbidities seen in COVID-19 patients and treatment options for a multitude of symptoms. Additionally, it offers preparedness steps for new surges in patients as the illness continues to develop.
Okay, and moving on to our key psychology books. The first is Flexible Working Practices and Approaches. So modern workplaces are following a strong trend of increasing flex work practices and approaches. They're offering more flexibility in working times, in our working places, and in our working organization. And as a result, the new information and technology has been combined into this book. It's a practical one for organizations implementing or considering implementing flexible work. So it's very much targeted for HR professionals, and researchers in the work of organizational psychology, and should be a great tool for anyone looking to see what it's like in a rapidly changing work environment and how those norms are impacting the day-to-day business. And the next title we have here is African Americans and Mental Health. This book enumerates the unique challenges, barriers, needs, and trauma of being an African American in the United States, and at the same time highlights what needs to be done to improve and foster the mental health healing of the population. This volume features the authorship of counseling professionals, most of whom are African American themselves. And because of their own personal experiences and perspectives, they are able to emphasize cogent helping strategies and show how to move forward with encouragement. The book also highlights ways to promote life that is mentally healthy and holistic for African Americans. It is an essential resource for helping professionals who work with the population, including psychiatrists, counselors, psychologists, social workers, and other mental health professionals. Okay, and the last title we have in our psychology highlights is Assessing Organizational Behaviors. So this book fills a gap in international literature by providing useful information to professionals on how to use psychological instruments to assess organizational behaviors. Measuring instruments can enable organizations to implement the evidence-based changes required for their survival. These changes demand diagnosis based on precise assessments of organizational and individual variables. But many times, the professionals responsible for conducting it are not sure what those tools are to measure to measure the business. The volume is divided into two parts. The first brings together chapters dedicated to micro-organizational variables such as job crafting, reactions to organizational change, psychological well-being at work, work retirement transition, resilience at work, and leadership in organizations. And the second deals with quality of life. So this is macro-organizational constructs. So building a climate for creativity, emphasizing values of the organization, assessments of support, and contributions by social network analysis and organizational effectiveness. So this is a really good tool book for measuring organizational malaise or happiness amongst its employees, and will be of interest to researchers and students in the field of organizational and work psychology, as it provides a comprehensive overview of a wide range of instruments and tools to measure different variables in our organizational behavior. And here we are with our retail books from Springer Nature.
Okay, thanks, Jenny. I'm pleased to share with you a couple of new highlights on our popular science list. Living through a global pandemic has turned all of our attention to the field of virology. This book makes this complex topic accessible to a lay audience. Viruses, Intimate Invaders guides readers through the fascinating world of viruses. It covers all the basics, including what viruses are, how they work, and just how much they impact life on Earth. The book equips the reader with the scientific basics behind virus function and presents the historic milestones of virus research and discovery. Well-known viruses such as HIV or influenza are examined alongside the novel pathogens in COVID-19. Perhaps most fascinating in the field of virology is how the immune system reacts to different viruses and how vaccines work to conquer pandemics. And the last title I'll highlight is about specifically what happens to the human body after death. If you just said you, I'm with you. But for anyone who with an interest in microbiology and the interconnectedness of nature, this is actually a fascinating topic. In the end, the human body is a complex ecosystem of microbes, insects, worms, plants, and more. Life after death is a captivating look at the science of death and decay that positions the human body as an important source of nutrients for creatures large and small. This book shares the remarkable science behind the recycling of the human body into new life, ultimately supporting the health of our planet.
All right, and thank you so much, everyone, for joining us for the Q4 2021 Clinical Medicine Highlights presentation. We hope you found it helpful. If you need anything, feel free to reach out to myself or Marit Bagstad. Our contact information is available on the slides. Thank you for joining us.
Thanks, everyone.